YouTube channel. Today we are going to talk about HIV and AIDS because 1st of December is the World HIV and AIDS Day, World AIDS Day, and it is approaching fast. It is next week, so we need to talk about it before the day comes, so that we can know how to celebrate the day, how to know how to recognize this day, screening, you know what to do before that time comes. So thank you. Sit back, relax, and grab a notebook and a pen because you're going to be discussing something serious. Thank you. HIV and AIDS. What is HIV? HIV is initial standing for Human Immunodeficiency Virus. Human Immunodeficiency Virus. So HIV affects your immunity. It attacks your CD4 or T lymphocytes or T cells. T cells are the soldiers of the body. They help to fight any virus, any germs in the body. So HIV attacks those cells. It uses them as a factory to produce more and more HIV cells. When it uses them, once it's done with them, it destroys the soldiers of the body, the T lymphocytes or the T cells. So now, since it has destroyed the soldiers of the body, it makes you to have low immunity. Low immunity will lead to you getting infections. They're called opportunistic infections. These opportunistic infections, as a collection, they form or they cause AIDS. So AIDS is acquired. It is acquired. So it is got from getting the virus. It is acquired immune deficiency syndrome. A syndrome is a collection of many diseases. It is a collection. So once you get opportunistic infections, these are infections that have an opportunity, which the opportunity comes from having a low immunity. So once you get low immunity, you get a collection of diseases. So we have staging. We have staging of HIV, that is from stage 1 to stage 4. So stage 4 is the last stage where you have AIDS. Once you move from one stage to the other, you can never go back to the previous stage. So if you are in stage 1, you cannot, then when you proceed to stage 2, you cannot go back. You cannot reverse your stage. So so once you go to stage 4, that is AIDS, you can never go back to being a normal person. But AIDS is just a term. It is just a stage, but you can live with AIDS for a lifetime when you're healthy, and you will not have any issues. But once you reach the next stage, you can never go back to the previous stage. So that is how HIV causes AIDS. So HIV causes AIDS. Now we go to the symptoms. Symptoms of HIV is, number 1, you get fever, flu-like symptoms. You can get flu-like symptoms or malaria-like symptoms. So you feel like you're having some kind of malaria or a flu. Then you have fevers. You have swollen glands. Swollen glands are all over the body. So you can get on the neck, under the armpits. You can also get in the crowns. So once you get generalized, the whole body has the glands which are swollen, you can think of something like HIV and AIDS. So you can also get frequent sore throats, night sweats. You wake up, your sheets are wet with sweat. Also muscle aches. You have headaches, frequent headaches. You can also have extreme tiredness, general body malaise. You have extreme tiredness. you have an rash that is unexplained, and also you can get nausea or vomiting. You can also get nausea or vomiting. So how is the transmission or the spread of HIV? So HIV is spread through body fluids like blood. You can have semen or vaginal fluid or discharge, and also you can get it from breast milk, that is mother to child transmission. So you can get it from also having breastfeeding your child. You can transmit to your child. So those are the only body fluids that can cause HIV. Number 1 is blood. Number 2 is semen or vaginal discharge. Number 3 is breast milk. So those are the causes, the ways of transmitting HIV and AIDS. So but it does not spread through the following: sweat, tears, saliva, feces, or urine. It does not spread through those body fluids or waste materials from the body. How do you prevent HIV and AIDS? Prevention is by safe sex practices, no sharing of sharp objects like needles, razors, toothbrushes, toothpicks, anything that is sharp objects. So kindly please, and also teeth, you can also transmit through teeth and others, etc. So that is how you prevent. You can also, if you are exposed by a person who has HIV and AIDS, or you suspect that this person can be having HIV and AIDS, you can visit your nearest health facility. We provide drugs called PEP. PEP is post-exposure prophylaxis, that is after exposure. But now we have people, couples called discordant couples. You find one partner is HIV positive, the other partner is HIV negative. So you can find one is negative, one is positive. So those are called, that is a discordant couple. So prevention of this HIV negative, individual from getting HIV, they use drugs called PrEP. PrEP is pre-exposure prophylaxis. So before being exposed, someone takes the drugs maybe for 1 to 2 weeks, but you continue as long as you are exposed. So in case the partner who is HIV positive is okay, like takes his or her medication very well, and then when you do the viral load, it is low detectable levels, that is LDL, or less than 20,000 viral load, he or she is not able to transmit the infection. So the partner is safe, can also go without using the PrEP. So the partner can go without using the PrEP if the partner is healthy and is taking the drugs well, and the virus is at a low detectable level. So those are the ways of preventing HIV and AIDS. Now treatment of HIV, we can have ways to prevent or to increase the CD4 cells. So you have ways, we can have natural ways and also pharmaceutical ways, artificial ways. Number 1, natural ways. First of all, increase of CD4 count, because once you are infected with HIV, your CD4 counts are, as I had explained earlier, are the ones that are attacked, the first ones. So in case you are HIV positive, you find your CD4 counts are low, Hence, you need ways to increase your CD4 or to reduce them from being distracted more by the virus. So number one way, natural way, you need 6 months to increase your CD4 count. Number one way is eating a balanced diet. A balanced diet goes a long way. Number one is balanced diet. Number two is exercising. Regular exercise, they go a long way. They help you, even if you're not HIV positive, living a normal life, living a clean life. You need to have to eat a balanced meal every day, and also to do regular exercises. Number three is cutting sugary drinks or sugary treats. Cutting sugary drinks and sugary treats can help you to increase your CD4 count. Number four is healthy hygiene. You need to maintain your hygiene of your body, because some infections can go through the skin, some infections can go through the mouth, and also reduction of normal bacteria in your system, like in your mouth and every other area that you need normal bacteria. The reduction can lead you to getting infections. That is, the normal bacteria helps to increase your body's immunity. It helps to increase your body's immunity. So kindly please maintain hygiene of your body, of your mouth, of everywhere in your body, from head to toe. Also, if you're a smoker, kindly quit smoking. It will help to increase your CD4 count. Reduce or stop alcohol intake or alcohol abuse. You can also use probiotics. Probiotics can come in form of tablets, can come in form of maybe drinks like yogurt and fermented milk. So you can do probiotics, and that is natural ways. So pharmaceutically, you need to take your medication, your ARVs, at the right time every day at the same time, at the right time. Kindly please do not default, do not take it at the wrong time. Take it every day at the same time, because now the virus is used to you taking your medication at the same time. This this will help to curb drug resistant, because we have first class drugs and then we have second class drugs. So as long as you are in first class drugs, you are safe. So kindly please take your drugs as prescribed by your doctor. Then we can have cotrimoxazole or Septrin. We call it Septrin. We take once in a day, every day. It helps to prevent very many diseases, opportunistic infections in HIV and AIDS. You can also take multivitamins. Multivitamins are also drugs that you can take at least to increase your immunity, to increase your CD4 count. So that is HIV. Kindly please note that HIV is everywhere. It is everywhere, and you need to prevent. And then if you're not having HIV and AIDS, kindly please note that we need to live as people who are HIV positive, meaning we need to be healthy. We need to be very healthy, to eat a balanced meal. We need to take precautions. We need also to maintain our hygiene. Everything that I've told you about the treatment, the natural ways, those go a long way. They go a long way to maintaining our health, be it any disease. If you maintain a healthy living lifestyle, you will prevent most of these diseases, both communicable and non-communicable diseases. So thank you for watching. Kindly please subscribe to my channel, click the bell so that at least you can get notifications once I post, and also like if you have liked the video, kindly drop a comment in case of anything, in case you have any questions, and share to your friends, to to your relatives, because we need to live a healthy life. So health is wealth. Thank you.